Thank you, Dr. Helms. I'm Patricia Hoffman. I'm an anesthesiologist, and I practice here in Des Moines, Iowa. And I want to tell you about an action the IMS Board of Directors took at our last meeting to help us protect our state's healthcare system. The IMS Board voted in February of 2008 to authorize the Iowa Medical Society to begin exploring litigation against the agency that runs Medicare. This agency is the Centers for Medicare and Medicaid Services, or CMS. Neither Congress nor CMS has acted to restore equity in the way Medicare reimburses physicians in rural states. Maybe the courts will. There are a number of things in Medicare physician reimbursement formulas that unfairly penalize rural areas. Just by the way of background, there are 89 different payment localities in the United States. The entire state of Iowa is in one payment locality. Thus, physicians rendering the same services in different areas of our states are compensated under Medicare in the same fashion, at the same rate. Medicare reimbursement was changed in 1992, and the current physician fee schedule uses a formula that emphasizes a relative value of all services rendered by physicians. The relative value is then adjusted by a multiplier and a conversion factor and a geographic adjustment factor, or GAF. The GAF is composed of three separate geographic practice cost indices, or GPCIs, and the three different GPCIs are physician practice expense, medical malpractice, and physician work. These three different geographic indicators are weighted differently depending on where you practice. As a statewide medical society, we have been advocating for years to have the federal government make changes to this flawed formula, but Congress seems to be paralyzed. Again, the reason we're doing this is to protect our state's healthcare infrastructure. Continuing to allow CMS not to cover the cost of caring for Medicare patients creates a cascading effect that impacts our entire healthcare system. It adds to and creates recruiting problems. It discourages from physicians currently practicing in our state from staying. And it encourages new physicians, to move to Iowa to practice medicine. It creates a higher workload for those physicians already practicing in our state, and affects our patients and their ability to access medical care. So this action of the IMS Board of Directors to explore litigation is important and unprecedented in our organization. And though we are in the early stages of exploring litigation, this sends a signal that Iowa physicians are alarmed about underfunding, and this is pulling the rug out from underneath our ability to care for our patients. Dr. Hubbard?
All right, thank you very much. Thanks for both of you. Just a couple of things to summarize then. First of all, I think that physicians probably want to be in a courtroom about as bad as lawyers want to be in a hospital, okay? This is not something that we take lightly, that we are exploring this option. We are just desperate. We are at a point where the way that Medicare is funded is going to start to hurt how we care for patients in our state. And it's going to be our quality is going to suffer, access to care is going to suffer. And one thing about this, too, is that we've had excellent support from our own congressmen and senators in Washington, D.C. They understand the problem, and we've had great support from them. The problem is that we have to get the whole Congress and the whole Senate, the House of Representatives and the Senate to both pass something that has to get through, has to be signed by the president, obviously, for anything to change. And we're just at the point where we just don't know if that's going to happen or not, and so that's why we're looking at these legal action to try to change something. And is this, there's, where do we go from here? And we're just going to go a lot of different places. Some of the recommendations in our task force report involve working with the Iowa legislature. Some involve federal action, and some involve working with both of our excellent medical schools here in Iowa. And our goal as an organization, our mission statement, is to assure the highest quality of health care in Iowa through our role as a physician and patient advocate. This study provides an excellent foundation for us as we continue our dialogue with lawmakers and other key stakeholders. And again, this is a great report. It's really, over the last few years, the board has met and we've kind of discussed these issues, and physicians across the state and probably the surgeons' lounges and doctors' offices have discussed these issues too. What can we do? What's really happening? And this report really puts that all together for us. And that's really going to be something with some great recommendations in here. And our next step is to start working on these recommendations. So I guess, thank you all for being here. If there's any questions, the three of us will be happy to try to answer them. And again, thank you very much.